Is it safe to use ibuprofen to stop menstrual bleeding?
Hello and welcome to today's discussion where we'll be tackling an important topic, the use of ibuprofen for managing menstrual bleeding. This is a question many people ask, and today we'll be diving deep into the facts and considerations to take into account.
What is ibuprofen?
Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, that is widely used to treat pain, reduce inflammation, and lower fever. It works by reducing the production of prostaglandins, substances in the body that cause inflammation, pain, and fever.
How can ibuprofen affect menstrual bleeding?
Ibuprofen, like other NSAIDs, can reduce the amount and duration of menstrual bleeding. The way it works is by reducing the production of prostaglandins, which are involved in triggering the uterus to contract and shed its lining each month. By lowering the levels of these substances, ibuprofen can make your period lighter and potentially shorter.
Is it safe to use ibuprofen for menstrual bleeding?
While ibuprofen can indeed be used to manage menstrual bleeding, it should be done under the guidance of a healthcare professional. Although it is generally considered safe for most people, it can have side effects, especially when used frequently or in high doses. Some common side effects include stomach upset, nausea, vomiting, headache, diarrhea, constipation, dizziness, and drowsiness. More serious but less common side effects include heart attacks and strokes, especially with long-term use. People with certain conditions such as heart disease, kidney disease, liver disease, or stomach ulcers should avoid using ibuprofen without first consulting with a doctor. It's crucial to remember that while ibuprofen can manage the symptoms, it does not address the underlying causes of heavy menstrual bleeding. If you're experiencing heavy or prolonged menstrual bleeding, it's important to see a healthcare provider to rule out more serious conditions.
What are some alternatives?
If you're looking for alternatives to manage menstrual bleeding, there are several options available. These can include hormonal birth control methods, such as the pill, the patch, or an intrauterine device, IUD. These options work by thinning the lining of the uterus, which can reduce the amount of bleeding during your period. However, just like with ibuprofen, these should be used under the guidance of a healthcare professional. To wrap things up, while ibuprofen can indeed help manage menstrual bleeding, it's important to use it responsibly and under the guidance of a healthcare provider. If you're experiencing heavy or prolonged menstrual bleeding, make sure to consult with a healthcare provider to explore your options and rule out more serious conditions. Thank you for joining us today, and we hope this information has been helpful.